Hi Senior 2, let's explain together the second part, which is the heartbeat. The heart keeps beating until the last time in the end of our life. The heart keeps beating and never stop beating. So the rhythmic and the regular heartbeat. There is a rhythmic and a regular heartbeat. It means what? It means إيقاعية. إيقاعية. Rhythmic, it means إيقاعية. They are originated from the cardiac tissue itself. We know previously that the heart muscle, is called cardiac. It's called cardiac muscle. There are a certain nerve in the cardiac muscle. Cardiac muscle, we said it is the same as heart muscle. In the cardiac tissue, there is a group of nerves. Okay, there is a group of nerves, or make a spontaneous make the heart beat spontaneously. يعني في عضلة القلب نفسها في مجموعة من الأعصاب بتخلي منبع نبضات القلب من القلب نفسه، هي من القلب نفسه. It means there are certain nerve centers in the heart make the heart beat spontaneously يعني تلقائي. As well as it has been proven that the heart continue beating regularly. If even you disconnected the heart, even you get this heart out of a rabbit or a frog or whatever, it will complete beating. Why? Because the heartbeat originate from the heart itself. لأن النبضات نابعة من القلب نفسه. It's not coming out from the brain, it's not coming out from the spinal cord, it's coming from the heart tissue itself. Heart tissue is called cardiac tissue. Okay, from some nerves connected inside the heart. So in this video we will discuss the origin of the heartbeat. We will discuss the origin of the heartbeat. It originated from where? What is the origin of the heartbeat? Okay, we will discuss this in this video. It comes from where? We said that there is a rhythmic. Rhythmic, it means إيقاعي. A rhythmic beating. It's related to the presence of something called sinoatrial node. What is the sinoatrial node? What is the sinoatrial node? So we are going to discuss this sinoatrial node. What is the sinoatrial node? We said that the heart beating related to the sinoatrial node, which is a nerve bundle, a bundle of muscle fiber, which is buried in the right side of the atrial wall, near the sites of the connection of the large vein. It means that the sinoatrial node, this is called sinoatrial node. Sinoatrial node. The sinoatrial node is buried, it means مدفونة, in the right atrium. This is called right atrium, if you remember. In the right atrium, it's buried inside the right atrium. It's bundles of muscle fiber, يعني مجموعة من الألياف العضلية العصبية مدفونة في right atrium, near the superior and the inferior vena cava, near the biggest vein. Let's say this again. What's meant by sinoatrial node? The sinoatrial node, we said that it is a bundle of muscle fiber. It's a bundle of muscle fiber. What is the meaning of bundle? Bundle يعني حزمة of a muscle fiber. It's a bundle of a muscle fiber, and it's buried. It means مدفونة. It's buried near in the right atrium. It's buried in the right atrium, near the biggest vein. What is the biggest vein? It is the vena cava, near the biggest vein. It's buried in the right atrium, near the biggest vein. The biggest vein is the superior and the inferior vena cava. Let's repeat this again. What is the sinoatrial node? The sinoatrial node, it's a bundle of a nerve. It's a bundle of a muscle fiber, يعني حزمة من الألياف العضلية, buried in the right atrium. This is called right atrium, near the superior and the inferior vena cava, near the biggest vein. What is the function of this sinoatrial node, which is considered as the pacemaker of the heart? We said it's considered as the pacemaker. It's considered as the pacemaker of the heartbeat. It's considered as the pacemaker of the heartbeat. يعني هي المنظمة والمسيطرة على الهارت beat. We said that we know previously from lower junior that the heart beat 70 beats per minute. The normal heart beat 70 beat per minute. 70 نبضة في الدقيقة. 70 beat per minute. This is the normal rate. It's connected with two nerves that affected the normal rate, which are a nerve that decrease the rate of the heartbeat and a nerve that increase the rate of the heartbeat. So the numbers of the heartbeat change according to the physical and the physiological states of the body. For example, the rate of heartbeat decreased during sleep, sadness, grief, or it increased during, for example, waking up, joy state, and performing severe physical effort. It means that the sinoatrial node is connected to two kinds of nerve, a nerve that decreases the heartbeat and a nerve that increases the heartbeat. When the heartbeat decreases during sleep, during grief, sadness, الحزن الشديد, and when it increases, if you are anxious, if you are worried, if you are wake up, if you are in a joy state, فرحان قوي, performing physical exercise. In the normal age of man, the heartbeat range from 70 beats per minute, 70 دقة في الدقيقة. Therefore, it pumps 5 liters of blood in each minute. So the heart will going to pump how many liters of blood? 5 liters of blood each. 5 liters of blood each minute. 5 liters of blood each minute. Okay, this is like an information in each minute, which is equal the total amount of the blood in the body. يعني 5 لتر دم دول هم تقريبا كل محتوى الدم اللي موجود في الجسم. Today we are going to recognize the mechanism of the heartbeat. We said that when the sinoatrial node sends the contraction impulses spontaneously, therefore it stimulates the muscles of the atria and it contracts. It means when the sinoatrial node it sends electric impulses, it sends impulses بترسل نبضات عصبية to the two atria, and the two atria will start contracting. Let's repeat this again. This is the first step. When the sinoatrial node sends electric impulses to the two atria, they contract. So the sinoatrial node will send electric impulses. Let's do it with this color, for example. This is the electrical nerve, as you see here. It sends the electric nerve to the left atria and to the right atria. These electric impulses, okay, will cause the two atria to contract. It will cause contraction of the two atria. So when the sinoatrial node will send the electric, it will send the electric impulses to the two atria. Two atria will start contracting. The sinoatrial node will send an electric impulses to the two atria, so the two atria will contract. And then the electric nerve impulses reach the atrioventricle node. The atrioventricle node. Where is the atrioventricle node? The atrioventricle node, it's a node between atrium and ventricle. The atrioventricle node that present at the site of connection between atrium and ventricle. It means the sinoatrial node will going to send electric impulses. It will send electric impulses to what? It will send electric impulses to the sinoatrial node. The sinoatrial node, it's node that is present between atrium and ventricle. Okay, it will send these to the sinoatrial node. It affects the two sides, of course. يبقى the sinoatrial node will send electric impulses to three things. Number one, to the right atrium, to the left atrium, and to something called sinoatrial node, So it will send the impulses also to the sinoatrial node. This is called sinoatrial node, affecting the two sides. It will affect the left ventricle, and also it will affect the left ventricle, and also it will affect the right ventricle. Okay, when the sinoatrial node, so this is called sinoatrial node. Let's write it. So this is another node called, I'll make it, for example, in this color, make it with this color. This is a this is an atrioventricular node. The atrioventricular node, here as you see, the atrioventricular node, this one, okay, it's the node between atrium and ventricle. Let's repeat this step again. When the first step, this is the sinoatrial node. We said it's a muscle fiber buried in the right atrium. Send electric impulses to the two atria. They will contract, and also it will send another impulse to the atrioventricular node. The atrioventricular node. What will happen to the atrioventricular node؟ هتقول لكم كده عليها بالاسود. 1 minute. So it will send the first impulses. It will be sent to the atria. This is the first thing. Okay, then the two atria will contract. It will send another impulses to the atrioventricular node. Here, the atrioventricular node is the node between atrium and ventricle, affecting the two ventricles. That's why it's called atrioventricular node, between atrium and ventricle. Then the two ventricle will contract, causing the contraction of the two ventricles, as we said, affecting the two ventricles. Okay, the impulses will spread rapidly from the atrioventricular node through the special fiber called Hess fiber, then spreading from the interventricular septum to the wall of both ventricles, causing stimulation of muscle, and so it will contract. It means when the sinoatrial node, when it reaches the sinoatrial node, there is a special fiber here. This fiber is called Hess fiber. The Hess fiber, it's a special fiber found in the septum. Septum اللي هو الwall between the left side and the right side. This is called septum. This is the septum. The septum, it's the wall الجدار اللي بيفصل ما بين ال right side وال left side. These electric impulses reach the atrioventricular node, affecting the Hess fiber. The Hess fibers are the fibers found in the septum between the two sides of the heart, affecting the muscles of the two ventricles, so it will contract. Okay, let's repeat this again. Senior 2. How the heart beats. Let's see how the heart beats. We said at the beginning there is a node. This node is called sinoatrial node. This node is present or buried in the right side, in the right atrium. This is a muscle fiber, يعني ألياف عضلية مدفونة في right atrium near the superior and inferior vena cava. It will send electric impulses to the two atria, left and right, so it will cause the two atria to contract. Then it will send impulses to something called atrioventricular node. Atrioventricular node, it's a node نبضة عصبية أو بؤرة عصبية موجودة ما بين الأتريوم والventricle. Spreading this electric impulse to the Hess fiber. What's the Hess fiber? Hess fiber ألياف موجودة في السبتم. Fibers موجودة في السبتم اللي ما بين ال right side وال left side, causing the muscle of the two ventricles to contract. Let's repeat it again. There is something called sinoatrial node. What is the sinoatrial node? It's a bundle of muscle fiber, حزمة من الألياف العصبية, buried in the right atrium. مدفونة في right atrium near the biggest vein, superior inferior vena cava, sending electric impulses to the two atria. The two atria will contract, and then sending electric impulse to the atrioventricular node between atrium and ventricle, causing spreading the impulses to the Hess fiber. The Hess fiber is found in the septum between the left side and the right side, causing the wall of the two ventricles to contract. Okay, and this is the way the heart beats. دي طريقة نبض دي طريقة نبض القلب. The last thing we're going to discuss, which is the sound of the heart, which we can distinguish. We have a long and a low pitch. Long, low. Long and low pitch. It's called lub. This is the side due to the closure of the two valves between the atria and the ventricle during the ventricle contraction. So when the valve between atrium and ventricle close during the ventricle contraction, it's normal that when the ventricle contracts, as we said in this diagram, we said that when the ventricle contracts here, as you see here, why the ventricle will contract? In order to pump the blood either in the pulmonary artery to the lung, or to pump the blood to the aorta, to all the body cell. So we said when the ventricle contract, in order to pump the blood, the two valves between the